Please be aware that the comments, views, opinions shared on this podcast are not meant to diagnose a medical problem and/or legal problem. If you do have a medical problem or legal problem, kindly contact a professional.
Welcome to An Apple a Day, a podcast, a resource, a community. Share your experiences and learn from others as we overcome barriers and learn to live a happy, healthy life with a disability. Welcome to the community. Here's your host, Jimmy Apple.
Welcome to another episode of An Apple a Day. I'm your host, Jimmy Apple. How you doing today, my friends? How you feeling? You feeling good? You feeling strong? You feeling better than you did yesterday? Excellent. Can't ask for better than that. You know the deal. Before I start, An Apple a Day is brought to you by www.famousapple.com. Famousapple.com is the home site for this podcast, so if you get a minute, go over there, check it out. Hey, here's a good reason to go over there and check it out. In this pandemic here, a lot of people have lost their jobs. Losing your job means you've lost your insurance also, right? Now, how are you going to get your prescriptions? How are you going to get your kids' prescriptions, your family's prescriptions? Cobra. Who can afford Cobra, especially now, right? Well, over at www.famousapple.com, on the podcast news page, there's an ad right in the middle of the page. It's for Blink Health. It's a prescription company. Now, it's a legit prescription company where you can get discount prescriptions. How does it work? You got to click on it and you can read it. What it does, though, is you can compare. You compare the medications. Write in your medication that you take and compare what you would have to pay out of your pocket to what they can get it for you at. It's amazing the savings that you can get. And it's not medication coming from overseas or being made in somebody's basement somewhere. This is medication coming from well-known pharmacies, Rite Aid, CVS, Costco, Walmart, Target, your local drugstore. You got to check out the site. If you like it, you try it. You don't like it, no harm. But when you see the savings, I can almost guarantee you're going to want to try it. And like I said, it's legit. There's no risk involved here. So go over to www.famousapple.com, go to the podcast news page, and just check it out. That's all I'm saying. It's one way to save some money in this mess that we're in right now. And while you're checking the web, make sure that you check out our group page on Facebook. Go over to www.facebook.com/groups/disabled living. It'll bring you to our Living with a Disability page. It's a nice little group. We've got a good amount of people in there. And there's some conversations going on, some polls you can take, and just some fun, something to kill some time while you're on the web checking it out. You're on your phone sitting at the chair, playing some games, whatever. Check out the groups. You never know. You might make some new friends, lifelong friends. I'm in there a lot. But it's something to do. Hey, we got a good one for you today. A lot of information from the CDC. That's right. And I've got some news for you about the masks. You know, they want us to wear these masks out in public and everything. And, you know, people are spending money. They're going out buying these medical grade masks, these N95 masks and stuff like that. You may be wasting your money. So I have an article here from Life Hackers about these masks. And you may be spending money, but it may not be helping you in the least. So that's something else we're going to look at. And, you know, we've talked about protecting ourselves during this pandemic and protecting our kids, which is very important, and our older folks, you know, grandma and grandpa, mom and dad and stuff like that. But what about our pets? The CDC had some information about pets that I want to share with you too, because some people got crazy. People were like just taking their animals and dumping them. How can you do that? I have dogs and cats, and they're like part of the family. They're like my kids. I could never. But I got some information on, you know, pets. Can they actually spread the virus to us, and are they carriers and stuff like that? So from the CDC, right from the big chief, the big muckety mucks. So we're going to go over that also. We got a lot going on here today, but there's a couple of things I want to talk to you about. Well, the stimulus payments are still in the news, and I've got some good news from Disability Scoop. It says stimulus payments may be extended to dependents with disabilities. A push is underway in Congress to make economic stimulus payments available to people with disabilities who are dependents. Many people with disabilities who will miss out on economic stimulus payments because they are counted as someone else's dependent, but that could change under a proposal in Congress. The government is currently sending cash payments to millions of Americans as part of a large package of relief efforts approved in March in response to the COVID-19 pandemic. Most individuals earning less than $75,000 annually will receive $1,200, and people making up to $99,000 will get a tiered amount. In addition, families who qualify will receive $500 per child under the age of 17. People with disabilities who get supplemental security income are eligible under the law unless they can be claimed as a dependent by someone else, a factor that disqualifies many of them. That would change under a bill known as All Dependent Children Count Act, or H.R. 6420. The proposal calls for cash payments to be extended to dependents with disabilities of all ages, as well as those younger than 19 and students ages 24 and under. In the middle of a pandemic, we need to look at our working families and make sure that we are doing everything we can do to provide financial support to those most in need, said U.S. Representative Angie Craig, who sponsored the legislation. When I learned that we were leaving out dependents over 17 and students up to age 24 as well as the disabled, I knew we needed to introduce legislation to fix this immediately. The measure has bipartisan backing with 147 members in Congress listed as co-sponsors, and Senator Tina Smith said she plans to introduce a similar bill in Senate, which already has support from more than a dozen members. Advocates with the National Down Syndrome Society are pushing families across the country to contact elected officials about supporting the bill, expanding the types of dependents who are eligible. Individuals with Down syndrome and their families have been significantly impacted by COVID-19. Many have lost their jobs, and providing care for someone with complex medical needs is costly. The economic relief money should not be denied to those who need it the most, the group said in an alert to supporters this week. The Department of Treasury began issuing stimulus payments earlier this month. After some initial confusion, the agency said that, like most others, SSI beneficiaries who qualify will receive payments automatically by early May in the same manner as they typically receive their benefits. Action is only needed from SSI beneficiaries who have children under the age of 17 in order to claim the $500 per dependent child payment. The cash payments will not be considered income for SSI recipients, and the funds will be excluded from resources for 12 months, according to the Social Security Administration. Now, I think that's great. The only thing I don't agree with is the students up to 24 years old. I think students up to 24 years old should have been working, but they should also be able, if they were working and paying taxes, they should be able to claim the $1,200. I don't think they should still be dependents, but that's neither here nor there. That's just my opinion. But I think this is a good thing, especially people with children like Down syndrome children. The Down syndrome children never leave home. They're forever dependents. So I think this is a really good thing. This is something that I would definitely support, that I definitely do support. So I just wanted to put that out there, let you know that they are working on something. So it's good. At least the disabled aren't being pushed aside or pushed under a rug. I just wanted to share that with you. All right, let's move on here. All right, this COVID-19, this coronavirus, it's getting worse and worse. Now the government tells us when we go out for our essential needs, we have to wear a face mask. And, you know, we're good people. We're doing what we're told. We're socially distancing ourselves from others. We're wearing the gloves. Now we're wearing the masks. And we're going out. We're buying the best mask we can, right? Well, if your mask has a valve in it, it's half useless, according to lifehackers.com. If you're wearing a face mask with a little plastic valve embedded in it, you should know that the valves compromise the effectiveness of the mask. And this is true whether your mask is a hardware store N95 or a designer cloth mask. These valves allow exhaled breath to bypass the filter. When you breathe in, the air you breathe is being filtered by the mask. When you breathe out, it's not. the valve only operates in one direction. One-way valves make sense if you're kicking up sawdust in your basement, walking around California during the wildfire season, or working in a factory where particles you definitely don't want to breathe in may be in the air. In these cases, the mask is doing its job. The valve makes it more comfortable for you to wear so you can get through your day or the factory shift without feeling too stifled. But that's not why we're all wearing masks right now. Why valves don't make sense for infection control? In the age of COVID-19, we wear masks when we're out and about for two reasons. One, we hope that they might protect us from other people, at least a little bit. The science on that is still not very convincing. The second reason is more significant. They protect us from infecting other people if it turns out that we're infected and don't know it. The valves defeat that second purpose. A valve mask is letting your breath out unfiltered. The valve acts as a little escape hatch for any virus-laden droplets that you're breathing out. Some municipalities that require masks have specified that masks with valves do not count. You also won't typically see valve masks in hardware settings for the same reason, as the CDC explains. Respirators with exhalation valves should not be used in situations where sterile fields must be maintained. For example, during an invasive procedure in an operating room or a procedure room, because the exhalation valve allows unfiltered exhaled air to escape into a sterile field. If you have a stash of N95s that you previously used as dust masks, or if you're considering buying designer cloth masks that have a valve, somehow the fancy ones all seem to have valves. Be aware that they only filter your inhaled air, not your exhaled air, and right now that's not good enough. As the saying goes, your mask protects me, my mask protects you. So please use the valveless mask to do your part in reducing the transmission. That's it. So you're wearing a mask not to protect you, but to protect me. And I'm wearing my mask to protect you. So we all got to do our part. And it makes sense. The valve's letting my filthy air out and letting your filthy air out. So just cover up with a regular cloth, regular bandana. Put a bandana around your face. Act like a cowboy or a pirate or something. But these fancy masks that you're spending this money on and looking all over to try and get, they're not worth it. All right, let's move on here. Okay, most people who own pets, they treat them like family. They treat them like children. I'm no different. I have a cat and two dogs, and they're our kids. And during this pandemic, they're just as susceptible to things as we are. So what do you do if you own pets? Well, until we learn more about this virus and how it affects animals, treat pets as you would any other human family members to protect them from possible infection. Don't let pets interact with people or other animals outside the household. Keep cats indoors when possible to prevent them from interacting with other animals or people. Walk dogs on a leash, maintaining at least 6 foot or 2 meters from other dogs and animals. Avoid dog parks or public places where large numbers of people or other dogs gather. There is a small number of animals around the world reported to be infected with the virus that causes COVID-19, mostly after having contact with a person with COVID-19. Talk to your veterinarian if your pet gets sick or if you have any concerns about your pet's health. Protect pets if you're sick. If you're sick with COVID-19, either suspected or confirmed by a test, you should restrict contact with your pets and other animals just like you would with people. Until you know more about this virus, people sick with COVID-19 should avoid contact with pets and other animals. When possible, have another member of your household care for your pets while you're sick. Avoid contact with your pet, including petting, snuggling, being kissed or licked, or sharing food or bedding. If you must care for your pet or be around animals while you're sick, wear a cloth face covering and wash your hands before and after interaction with them. If you're sick with COVID-19 and your pet becomes sick, do not take your pet to the veterinary clinic yourself. Call the veterinarian and let them know that you have been sick with COVID-19. Some veterinarians may offer telemedicine consultations and other plans for seeing sick pets. Your veterinarian can evaluate your pet and determine the next steps for your pet's treatment and care. For more information, visit What to Do If You're Sick on the CDC's website at cdc.gov. Stay healthy around animals. In the United States, there's no evidence that animals are playing a significant role in the spread of COVID-19. Based on limited information available to this date, the risk of animals spreading COVID-19 to people is considered to be low. However, because all animals carry germs that make people sick, it's always a good idea to practice healthy habits around pets and other animals. Wash your hands after handling animals, their food, waste, or supplies. Practice good pet hygiene and clean up after the pets properly. Talk to your pet's veterinarian if you have questions about your pet's health. And be aware that children 5 years of age or younger, people with weakened immune systems, and people 65 years of age and older are more likely to get sick from germs that some animals carry. For more information, visit CDC's Healthy Pets, Healthy People website at cdc.gov. Like I said, your pets are like your kids too. Pets are part of the family, and you have to treat them like part of the family. You have to watch out for them. So, there you have it. I want to thank you for stopping by today. We had a crazy week this week, and we're going to have another one next week. So, I want you to have a great weekend. Enjoy the weather. It's supposed to be great this weekend. And watch out for us next week. I'll talk to you again on Monday. So, wow, we're going to have a good one next week. I can't tell you what it's going to be, but I'll give you a slice of the apple on Monday. You've been listening to An Apple a Day, and I want to remind you of something. There is no such thing as a disabled person, only a person with a disability. And it doesn't matter. You don't have to be ashamed how many times you fall. You have to be proud of how many times you get back up. That's the big thing. Okay, my friends, you've been listening to An Apple a Day. My name is Jimmy Apple, and remember, the best medicine is laughter. I'll talk to you next week.
Thanks for listening to An Apple a Day with Jimmy Apple, your gateway to a happy, healthy life. Join our community at www.famousapple.com. See you next time.